that be used on the customers before they receive a tattoo?
Sure, it's chlorhexidine. You can buy it in any drugstore. It's the best agent for that.
And that would be the preventable measure.
It can't eliminate it. It can't make it zero, but it's going to certainly reduce it down.
Thank you for your testimony, because Dr. Simon, what our ultimate goal is to reduce any type of communicable disease or infection when people are getting the tattoos, because when you think about going to a doctor's office, at least for a body piercing or to pierce your ears, it's different than when you may go into a salon to get it done. So we want to ensure that those same measures are put into place when people receive a tattoo or body piercing. So thank you so much for your testimony.
Thank you.
And next we'll hear from Paul Rowe. Carl Hedgepath. Mr. Hedgepath?
Yes.
I'm sorry, Mr. Hedgepath, you're the owner and tattoo artist of Jinx Proof Tattoos.
Yes.
I'm sorry, I'll call up Mr. Rowe next.
Okay. I appreciate what the doctor had to say. A lot of that stuff I think pertains to tattooing, not relevant in my lifetime. I opened a shop here in D.C. 15 and a half years ago. We have absolutely performed a minimum of 70,000 procedures or more having to do with tattoos or piercing. I've never had one instance of any problem. We've never had one, lawyer or any kind of situation say that, ink caused their tattoo to be infected or anything like that. It's very uncommon. It's not. He is correct. It could happen, especially with somebody doing it out of their house, someone that doesn't know what they're doing. When we got here, there were no rules for tattooing or body piercing, and we have done above and beyond industry standards to see to it that we are not responsible for adding to that type of situation. We highly recommend that no one under the age of 18 get tattooed. We do not do that procedure and never have. A person should be 18 to get tattooed, in my opinion, but that's not the opinion of others probably here or around the states, including Maryland and Virginia. We do perform a few body piercings on people 16. They must have an adult with them. They must both have picture ID, and it both must have the same last name, or they do not get body pierced at my shop. Those are the type of standards that I would be mostly interested in. Using a needle a second time on anyone, I don't care how long you sterilized it, is not acceptable in my shop, nor in probably anybody's shop sitting behind me. Needles should be made and used on one person and one person only and thrown away or in a biohazard container. We do monthly spool testing on our autoclave to make sure that our autoclave actually works and isn't just sitting collecting dust on the table. If you have an autoclave and you do not do that, you have no idea whether it works or not. Those are the kind of things that would, help a tattoo or body piercing place be cleaner. I mean, no one can sit here and help someone learn how to tattoo. I mean, that's, you either do or you don't. But,
what do you use to sterilize the skin before you tattoo?
A mixture of soap and water.
Are you familiar with what Dr. Simon mentioned?
Yes.
And why wouldn't you use that?
Like I said, I do everything as per industry standards, and I have never had a problem. And I definitely have done quite a few procedures. It is the standard.
With regards to the pigments that you use, do you know if they contain nickel or iron?
I would say they absolutely do not. I do not have a scientist sitting next to me to validate my statement, but I would say that those are pigments that were made a very long time ago. They are not sold today. You have thousands of people selling pigment to millions of people across the world. They do not,
Do you know what the pigments are made out of? What's included?
I would not be. Each pigment is different, and I could not really tell you that.
And why do you recommend that those under 18 not get tattooed or body piercings?
Because I believe that they are not an adult. And I don't, I've had parents come in and yell at me because I won't tattoo their 14-year-old kid, and that's not my problem, that's theirs. I feel a responsibility whether they do or not, so they can get that elsewhere.
Now, do you go outside of the tattoo parlor to go to persons' homes?
Absolutely not. Not one time ever.
Are you aware of any tattoo artists that do that?
Yes, that is a common practice and should not be allowed.
And what was your training?
I've been working in tattoo shops for 18 years.
When you began?
Like an apprenticeship. You have an apprenticeship, you learn how to do certain things.
So, I'm sorry?
I said you have an apprenticeship. It's very similar to learning how to be a plumber. It's a trade. You are taught small things
How many
at first.
hours?
I don't know. 80 hours a week for the rest of my life. I don't know.
So there's no regulation like for, a barber or cosmetologist?
No, it's next to impossible to do that. I could, you could say that a person is not in cosmetology knows how to do a body piercing, and I don't know how to cut someone's hair. So it's the two don't match. I don't believe that you should be doing body piercing if you're in a hair salon.
There is a certain amount of training.
That's right.
That you are required to have for any trade, as with plumber, electrician.
I have 7 tattooers. I have 7 tattooers at my shop, and 5 of them have been tattooing 18 years or more in a professional tattoo studio.
And I understand that, but there should be a certain, or I would think there should be a certain amount of hours before you're considered, a licensed tattoo artist. I would
that's
think.
Fine. That's how we do it in Virginia. I mean, I understand where you're getting at. So
I know it's an art.
Mm-hmm.
It's an art, and you're artist.
Well, it's a trade. It's a trade. It's an art, but there's just as much of a trade skill to it as well.
Well, therefore, you should have a certain amount of hours
Sure.
to be confident that person is ready to do what they're doing, I would think.
Sure.
But thank you for your testimony. Next, we'll hear from Mr. Knopp?
Yes. How you doing?
Please make sure is the green light on?
Yes.
Thank you.
I'm going to say the same thing about thanks for the doctor, but most of the stuff he had to say about tattooing was completely outdated and incorrect, because all ink used is poured out and individually for each customer. It's not reused. Same as each needle, it's not going to be reused, no matter how, if someone's doing that, it's completely ridiculous, and they've got no business whatsoever in this industry. I'm not sure exactly what everyone's looking for with these regulations. I understand that it would be nice to be able to actually make this where you could police maybe what people want to do is police the industry, I guess, somewhat, but I don't see how it can be done with the state that what we have, or what everyone wants to have done, because not everyone's always going to be on the same page when it comes to different ideas. There's plenty of places that are tattooing minors. I'm the same with Carl. In his shop, we don't tattoo anyone under the age of 18 years old, and hell, I've had people bring in their newborns and get pissed at me because I wouldn't tattoo their newborn. But it's also the same people that call and want to.
People bring in and want to tattoo.
I've had people that have tattooed their newborn because it's their baby. It's completely ridiculous, and And you asking Carl the question, why shouldn't somebody under 18? So it's almost why, surprised you're not asking me why I wouldn't tattoo a newborn. You see how ridiculous it sounds.
Wow. Unbelievable. I wanted
when
to
it comes to, same as with the piercings and stuff like that, there's a few things we do on people below the age of 18, but for the most part, it's 18 and above for most piercings and whatnot.
Do your clients or your customers, do they receive any type of
They get a written
statement?
They get written aftercare with whatever's done with
No,
them.
do you give them something before to tell them of some of the warnings or cautions that might happen before they get a tattoo or body piercing?
I mean, honestly, as long as everything's done correctly, there's no issues that come about.
So is there any signed statement?
I'm going to have people are going to fill out a release form before they're getting it done, and they're going to tell me if they're allergic to something or if they put something down that I might feel would hinder the tattoo and or piercing.
What would prevent you from the questions that you ask? What would prevent you from giving someone a tattoo?
Depending what, somebody might be allergic to something. They might not be, they might not. There's people that when they heal things, they scar, keloid, whatnot, that I wouldn't necessarily suggest getting,
Is there a way you could provide me, either of you, with a document that you give persons to sign? I would really like to see that.
I could fax you one over.
Okay. So what questions are on there? What medical questions do you ask?
I want to know what, if you're allergic to anything. I want to, if you're allergic, then what are you allergic to? Basically, do you have anything that's, contagious, any contagious disease?
And if they say yes?
Then we handle it, each case, differently. I mean, there's not that you can't, you can tattoo somebody with HIV. I mean, there's people with certain conditions where I might want a doctor to, if you have a heart condition, I'm not going to tattoo you. I'm going to want your doctor to, you're getting tattooed, because I also don't want, it's traumatic, it's trauma to your body, and it's, people go into shock. And
so if someone is HIV positive, you
could tattoo them.
You tattoo them?
Yeah.
Okay. But you just want to know that ahead of time?
Of course.
Would you get them to okay that with their doctor?
They also have to okay it, because healing, it's, it's hard to heal something.
So you're depending on the patients to give you that accurate
Well, of course. It's, same as somebody coming with an ID. I mean, I'm not, I don't have a book of fake IDs, and, I'm not trained on, but I'm going to look at everyone's ID, and hopefully, people that are coming in, it's legit.
Just the last question, just the last question. Do you maintain insurance liability?
Yes.
In case okay. And what is that? What do you have? So if someone comes back and they have an adverse reaction, you would be able to cover that?
Yeah, but I've never had it, so.
You never had that to happen, either of you? No one has ever come back to you with any type of adverse reaction or illness? No. Well, thank you all for... And where are your shops located? I'm sorry, you're both in the District of Columbia.
Yeah, I'm in Adams Morgan.
Adams Morgan.
I'm on M Street in Georgetown.
Thank you. Thank you.